Hello, in this video I would like to show you how to use sphere massage balls or any other type of massage ball pretty much to release your quadriceps muscles. A quadricep is the muscle that runs in the front of your thigh, in the front of your leg, and this is the largest muscle in our body. It is used for most of our daily activities, walking, sitting down, getting up, anything that involves movement of the leg. Quadriceps is involved in that. And this muscle a lot of times has trigger points because it is so large and it is involved in all of our daily activities. One of the most common symptoms or types of pains that are caused by trigger points in the quadriceps are knee pain. So a lot of people might mistake this knee pain for some kind of joint issue, and it can be, and joint issue has to be addressed and by the medical. Okay, one more time. Hello. In this video, I would like to show you how to use sphere massage balls or any other type of massage ball to release your quadriceps muscle. Our quadricep, or quads as a lot of people call them, are the muscle that runs in the front of our leg. That's actually a single muscle that has 4 heads, and all of those heads attached right around our kneecap. We use this muscle all the time for walking, running, sitting down, any type of activity that involves our leg. And obviously this muscle can harbor a lot of trigger points because it gets overused a lot. There are a lot of injuries that can bring trigger points in this area, a lot of misuse, overuse, or even not using it enough or in proper way, like misalignment, postural misalignment. All of those things can cause trigger points and some kind of dysfunction in the muscle. So one of the biggest things that you'll know that, hey, this muscle needs some kind of attention would be knee pain. Trigger points in the quadricep usually cause knee pain right around the top and outside. So this kind of pain can be a lot of times mistaken for some kind of joint issue. And if you think that you might have that, first of all, get checked out by a medical professional just to make sure that you don't have any joint problem, arthritis, things like that. But if that all has checked out, is cleared out, you don't have any issues like that, then let's try to work with your quadricep and see if we can release some of those issues. So first we're going to use our 2 balls. We're going to use the large smooth sphere ball, and then we're going to use our small sphere ball. So we're going to go ahead, and obviously the first thing that you can do, anybody can do, is just kind of apply pressure like this. You're going to place the ball, press it into the muscle, and even if you're particularly tight or you have really persistent trigger points, that can already help you start releasing them. So you're going to apply pressure and then kind of try to squeeze it out, and you might feel that muscle kind of bulge up and move to the side. So you want to keep the ball on the muscle and just kind of keep applying the pressure. So this is the first step. This kind of massage is the most gentle one of all. You can do the same thing with a small ball. You can press and start rolling it through a little bit, so kind of tiny little strokes. Press in and push forward. Press in and push forward so that the ball, the texture of the ball, it grabs the skin or kind of pulls the skin with you, and you're trying to separate the skin and the fascia that's under the skin from that muscle. So that's how we're taking care of the possible scar tissue or fascial adhesions. So we're going to do that all over the muscle. And we're going to go to the outside and just kind of keep going, rolling it like this. And once we get closer to the kneecap, be careful not to go over the joint itself. Go in the muscle, the soft tissue, not over your bony parts. So now that we're done massaging our quads, let's go ahead and turn around and apply some deeper pressure to our quadriceps. We're going to go on our stomach. Go ahead and take your large sphere ball first, because it will let us roll out the muscle like you would use a foam roller. So go ahead and place the ball under kind of the middle of your quad and start gently rolling, slowly rolling through the muscle. You want to cover as much area, as much space as possible. So start by going small sections, about 2-3 inches long. You're going to press into the muscle and roll forward and slowly back. And then you're going to maybe rotate a little bit to the side, going on the inside. You can roll forward and back. Keep going, forward, back. And move over and then go more to the outside. So to make sure that we cover the whole big muscle. Go ahead and roll down. And now we're getting closer to the kneecap. That area usually has a lot of trigger points right over here, the lower part of the quad. So we're going to roll it out and turn around. And you can try to bend the knee a little bit and release. Applying the steeper pressure. Then we can shift the leg on the outside. And you can keep rolling through it. And pay attention if you find any spots that are particularly tight, because that's where we would want to stop. So now let's go ahead and take our smaller ball. And for example, I found a spot over here on the outside and on the inside. And this is the spots that I'm going to apply deeper pressure to. So we're going to place the small ball and press into it and just hold it there. And the smaller ball will give you a lot more pressure, so it might be very sensitive right now, especially the inside of the leg usually gets to be very sensitive. And just hold it there and breathe. Okay, let's go ahead and turn to the other side. And again, that was another spot where I found it. Kind of felt the pain going down to my kneecap. So you might have the same thing, or you might have different trigger points. Wherever you felt the most sensitivity, that's where you want to stop. Good. So, and you can usually spend a lot more time on your quads simply because it's such a long muscle, such a large muscle. But now we're going to go a little bit to the outside of the leg. So this part of the quadriceps is called Vastus Lateralis. And this is the largest portion of the quad that wraps around the side of the leg and goes attaches right over here at the back of the kneecap. This muscle covers the bone, the femur, and on top of the muscle we have the IT band. A lot of people, especially in the gyms, they like to roll fast on this IT band, roll through the pain, grind their teeth, like make all this crazy expressions with their face because it hurts. It hurts so much. But by rolling on that IT band, this really long and thick piece of connective tissue or fascia, we're not accomplishing anything. We're hurting ourselves, but we're not lengthening the IT band. It can lengthen. We're not really helping ourselves in any way. Instead of that, we want to let's take our large ball, and we want to roll our vastus lateralis that covers the bone, but we don't like to roll on the bone itself. When I get into the muscle, you're going a little bit on the outside, just a tad, and that's where you can find those trigger points and just go ahead and press into it, and you can feel pain going all the way into the kneecap over here on the inside or the outside, and just kind of pause there. And just keep going deeper. Just you can release it a little bit if you feel that it's too much, and then kind of apply more pressure again. You can take a smaller ball if you found a precise location of a trigger point. And again, do the same thing. You can place it over here. You can even place the other leg on top, apply pressure like that. You can lay down and just kind of rest in this position a little bit. You can come up and again bend the knee, place pressure like so. All this, the change of the body position will change the amount of pressure that you can apply on the trigger point, and that's what you want, so you can move it a little bit sideways. And then we're going to go a little bit on the front part of our vastus lateralis. So we're going to, again, we first use our large ball. So instead of rolling over the AT bend, we're going to shift the weight of our body forward and roll out the front part of this muscle. Again, the closer you get to the kneecap, that's where you're going to feel more trigger points usually. Then you're going to go a little bit more. And again, we can use our smaller ball to place pressure in this area. Here we go. So that's a spot for me, just kind of hold it there. And release. So once we're done with our quadricep release, good thing to do is just to perform a stretch. So we're going to turn around on the stomach. One thing that we can do is simply bring the knee in, hold on to the ankle with your hand. If you can't reach it, just go ahead and grab the belt or a strap, like a yoga strap, and try to bring the heel down towards the bottom. Lift up, but keep the hip down, so you can lift the knee up a little bit to increase this pressure, increase the stretch. Hold it there. I'm gonna hold it for about 20 seconds. That's gonna be good. I'm gonna come down, lift up. Another way to stretch, you're gonna place the foot forward and then apply pressure with the weight of your body forward. Go ahead and lean down, so you're going into your hip flexor over here. Now you can keep your hands down, you can keep them over here if you have enough flexibility in you. Now you can try to bring the back leg up and then pull it back again. You can use a strap or a belt over here, and this will really get deep into your quadricep. Hold it here, lean forward, try to isolate this muscle, use your core to support, control the rest of your body, and release it. Okay, now that we're down with the first leg, we need to go ahead and do the same routine on the other leg. So you can go ahead and repeat the video and follow the same steps for your other leg.